We're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for Health System CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now.
Welcome to the Health System CXO Podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. My name is Anne Herleth, VP of Member Insights at the Health Management Academy, and your nurse executives host, discussing the issues that matter most to nurse executives, their leadership teams, and systems, and inspiring innovation across the practice and care continuum. As nurse executives and their broader nursing leadership teams look to solve a litany of workforce and financial challenges, one solution that continues to rise to the top is virtual nursing. Perhaps the hottest topic in nursing in 2022 and 2023, virtual nursing has been talked about like it's a magic solution, solving vacancy, driving better patient outcomes, making nurses happier, and hopefully increasing productivity and saving money. So today, I want to talk about virtual nursing and decide if it's worth the hype, or more specifically, answer the question, is virtual nursing the care delivery transformation that can solve nursing's woes? Or is it simply a tool, something that's nice to have, but certainly no silver bullet? All right, I want to start with some basics because virtual nursing in theory and practice varies widely. I often say if you've seen one virtual nursing pilot, you've seen, one virtual nursing pilot. So for the purposes of today, let's define what virtual nursing is and is not. And I want to start with what it's not. It's not outpatient telehealth visits, telehealth disease management, or really any sort of outpatient telehealth anything. It's not behavioral coaching. It's not virtual sitting or even EICUs. Rather, virtual nursing is when you have a, virtual nurse who oversees or directly supports a bedside team that is delivering care. If you are a visual person like me, picture this. You have a nurse who is sitting in a high-tech command center surrounded by screens that look something like a mission control room. They're connected to patient rooms via 2-way cameras and microphones, and this allows them to interact with patients and bedside staff in real time. Now, these virtual nurses, they're not replacing bedside nurses. They're supercharging them. They handle things like admissions, discharge, medication education, and even keep an eye out for any signs of patient deterioration. It's like having an extra set of expert eyes and ears on hand. Now, virtual nursing, it isn't one size fits all. Some hospitals are using mobile carts and tablets, while others have cameras installed in every room. Some virtual nurses focus solely on admissions and discharge, while others are more involved in ongoing patient care. It's a little bit choose your own adventure right now. Here's the best part. Virtual nursing is helping hospitals tackle real challenges, things like staffing shortages and experience shortages. Many times we see experienced nurses who may not be able to handle the physical demands of the bedside job anymore, put their skills to use as a virtual nurse, and really scale their expertise. Plus, it's giving those bedside nurses a break from some of the more time-consuming admin work. So it's win-win, or at least that's what anyone who is pitching virtual nursing to you will tell you. So I want to talk a bit about ROI here because my team, Nursing Catalyst, spent the better part of a year tracking virtual nursing pilots across 15 large health systems. And there is good news when it comes to ROI. Those outcomes that I just mentioned, we are seeing them pretty much across the board for many organizations. In fact, we typically see 4 main paths to ROI when organizations implement virtual nursing. The first is really about the nurse experience. Happy nurses mean better care and less turnover. We saw one health system with their turnover rate plummet from 27% to just over 1.5% after implementing virtual nursing. Now, granted, with any rate of turnover, you do have to give it some time to make sure that it is the true outcomes. But again and again, we see pilots where nurses are reporting higher satisfaction And eventually, units are able to report lower turnover rates because nurses like to work on virtual units. Outside of the nurse, of course, there's the patient experience and care quality. And this is the second path that we see to ROI. Patients like the extra attention. We saw another health system report a whopping 66% increase in their patient experience scores after implementing virtual nursing. Plus, hospitals are seeing fewer falls and readmissions. So, all in all, virtual nursing, good for the patient. The third bucket is really around care efficiency. And this is where you start to see some of the bigger financial impact. Health systems have reduced things like average length of stay by over a day after implementing virtual nursing. And considering the cost of a patient each day, or really each hour, matters. The last one is tricky, and this is where labor productivity comes in. I think some hospitals are still hoping to use virtual nursing to allow bedside nurses to handle more patients, but it is a delicate balance. Anytime we talk about changing ratios on the unit because of virtual nursing, we have to really think through the model of care that is supporting the virtual nurse. And to be honest, we haven't seen that many systems move in this direction yet. Here's the kicker. Most CFOs want to see efficiency and productivity gains. So while everyone is tracking patient satisfaction and quality metrics and rewarding happier nurses, it might not be enough. We have to get CFOs and other executive leaders aligned behind a shared, realistic vision of what virtual nursing ROI can look like. That said, we have potentially cool technology, and we are improving care. We are potentially saving money, at least if we look at it through length of stay and retention. So I think it's time we revisit the big question. Is virtual nursing the care delivery transformation that solves nursing's woes? Or is it simply a tool, something among many to consider? Because the answer to this question will help first set expectations among nursing and non-nursing executives, particularly around the questions of how big we should go. And it directly aligns with the type of ROI you should be pushing for. So here's my take. My take after watching and looking at so many models across the last few years. Most models of virtual nursing today are using virtual nursing as a tool. Often what we see is a glorified ADT nurse. True innovation when it comes to virtual nursing means integrating virtual nursing into the core care model. This involves rethinking how care is delivered, leveraging technology to address current challenges comprehensively. It means using virtual nursing not just for efficiency, but as a fundamental part of the care model. It's about creating new roles, career paths, and even educational models for virtual nurses. And right now, many are piloting virtual nursing, but few have fully integrated it into their model of care. And to get to this greater transformation and to see the best ROI possible, health systems will need to push for this deeper level of integration into the virtual models. To be clear, I think it's okay if your health system decides to use virtual nursing as a tool, but that requires us to be very direct with our nurses and our CFOs about the vision. Otherwise, you'll be facing a challenge I see widely now. Pilots stuck in pilot purgatory because financial leaders are expecting magical cost savings that don't exist unless you fully change the model of care along with virtual nursing implementation. Before we wrap, I'd be remiss if I didn't talk a bit about scaling pilots, because regardless of your approach, whether you're thinking about virtual nursing as a tool or full care model redesign, pilots need to get to scale or we need to cut them off. So I want to share a few approaches that we have seen from early virtual nursing adopters who have gotten to full scale at this point. There are 4 approaches. The first is what I like to call the toe dipper. And this is the phased approach to expansion. We go to a few different units to refine the model. It's a bit like testing the water before fully diving in. Number 2 is a bit different. This is the perfectionist. We often see this on designated innovation units where we'll test and we'll test and we'll test and we'll test and we'll measure and we'll try to iterate and we'll make it better before we hit scale. This is the measure twice, cut once of healthcare innovation. The third is all in, the enterprise-wide approach to rapidly expanding a pilot. We typically see this with more narrowly defined virtual nursing pilots. So truly, when organizations are scaling quickly, we often see them using virtual nursing as a tool. I don't want to say everyone is doing that, but often when we see fast scale, it's happening because someone is using virtual nursing in a more narrow scope. The fourth is the multitasker. This approach expands to other disciplines, creating a multidisciplinary virtual care model. I think for organizations who are going down the path of using virtual nursing for full care redesign, we will see more and more of this multitasker or multidisciplinary approach in the future. Now, when it comes to scale, the best option is really the one that aligns with your system strategy. That said, across all four approaches of scaling, frontline involvement is critical. Successful programs are really putting bedside nurses and unit managers at front and center in the decision-making process and are seeing greater success because of it. So if you are thinking about implementing or scaling virtual nursing, my biggest piece of advice is to make sure you have frontline buy-in, and that includes both nurses and your unit level leadership. Thanks for tuning in. Until next time, keep innovating. Thank you for joining me on the Health System CXO Podcast, where we activate health system leaders towards outcomes and scalable solutions that you can implement now. Remember to subscribe to the Health System CXO Podcast on your favorite podcast platform so you never miss an opportunity to hear more. And if you liked the episode, consider leaving us a review and sharing our podcast with your colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.